Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of March 2nd, 2023. This week, I'm going to address some questions that have come in from viewers and friends, which is how much should we rethink our assumptions about COVID-19? In the past week or so, there have been reports that SARS-CoV-2 may have come from a lab leak in China. And there was a report that suggested that masks may be of no benefit in controlling COVID-19. These are both different things than what we assumed or what we were told or what we believed before. So let's take a look at what the data say and whether we should change our thoughts. So it's pretty well known that the New York Times reported that the Department of Energy just a week or so ago, reported that a lab leak was the most likely cause of the COVID-19 pandemic, specifically a lab leak from the Wuhan Institute of Virology. And this report, the New York Times report, not the Department of Energy report, the New York Times has prompted, new intelligence has prompted the Energy Department to conclude that an accidental laboratory leak in China most likely caused the coronavirus pandemic. Now, some folks that were briefed by the Department of Energy said that, in their opinion, it was a relatively weak conclusion, and the Department of Energy reached it with low confidence. And while the Department of Energy shared it with other intelligence agencies, no one changed their mind. But importantly, the New York Times said that the report was not disclosed. So we don't know yet what the specific information that the Department of Energy acted on. We do know that the Federal Bureau of Investigation, the FBI, had previously concluded that it was probably a lab leak, and that was reiterated by public statements this week. But four other intelligence agencies and the National Intelligence Council have concluded that it most likely came from natural transmission. Now, again, with low confidence, but some, the so-called Wuhan wet market, right? This idea that the virus existed in animals, jumped to humans as other viruses have done. Two intelligence agencies have not expressed an opinion. The World Health Organization has said that the lab leak theory was unlikely, but that was some time ago, and I haven't seen a more recent report from them. But it is generally agreed by everyone involved that it was not being developed as a biological weapon, right? So at this point, there is no definitive evidence. Assuming that the Wuhan Institute of Virology was working on coronaviruses, then either a lab leak or natural acquisition from an animal is possible. If I were looking for an answer, I would want to know several things that I haven't seen. And that is, what coronavirus were they working on and why were they working on it? Coronaviruses, there are 7 that are known to affect humans. 3 cause serious disease, 4 cause a common cold, and it may well have been that they were working on one of the coronaviruses to try to develop a vaccine or something like that. On the other hand, if they had modified it, that might suggest other purposes. I would like to know what kind of biohazard control they have at the Institute and what the nature of the training was of folks who were working with the coronavirus. But perhaps most importantly, what we haven't seen is genetic comparisons between the first human isolates. In other words, once the virus was spreading around the world, what did the virus look like? What were its characteristics? Was it like the one that they were working on in Wuhan, or was it like the one that was more common in animals, particularly bats or pangolins or other animals? So without the answer to all of them, there really is no definitive answer. And at this point, one could make the argument that a lab leak or a natural acquisition is possible. Now, when we see the Department of Energy information, they may have the answer to some of these questions that will help us know more. But right now, we really can't. It doesn't matter really what we think because there are no definitive information. Perhaps a more challenging report came out at the end of January, and that is one from the Cochrane Collaborative, a very well-respected organization that tries to find evidence-based to support medical practice. And they concluded that wearing masks in the community probably made little or no difference in the outcome of SARS-CoV-2, that's COVID-19. They said that with moderate certainty. They compared respirators with surgical masks and concluded with moderate certainty that there was no difference. And they concluded with low certainty that hand washing might be effective. Almost immediately after that, a number of organizations, notably the Center for Infectious Disease Research and Policy, CIDRAP, issued commentary responding to it. And it's a long article. I'm not going to try to summarize it, but others have pointed out some concerns. But virtually everybody on both sides of the argument agree that the types of studies that should have been done to answer the question were never conducted. People have also pointed out that if someone is more likely or less likely to wear a mask, there may be other characteristics about them. They may be older, they may be more willing to socially isolate, and so on. So it's not as easy as it might seem to compare one group of people to another. And a very important point has been made, which is even people who wore masks some of the time could not wear them all of the time. And because of the widespread distribution of SARS-CoV-2 and how easy it is to transmit, even people who wore masks some of the time were probably being exposed at other times. It has been pointed out that most of the studies in the Cochrane Collaborative were pre-COVID. That may or may not be relevant. And some looked at mask mandates and not mask wearing. And the analogy here is it doesn't matter whether seatbelts help or not if people don't wear them. And the final point is, because such a high percentage of people with COVID were asymptomatic, it may not be possible to know all the time whether someone was or was not infected. So where does that leave us? In terms of the origin of the virus, you have two different hypotheses, neither of which have been proven. In terms of masks, you have different credible organizations reaching different conclusions. But over the course of these short public health videos, I've stressed the importance of trusting the experts. And right now, I would say the most recent expert report that I can trust is the Cochrane report. So I would slightly fall on that side until new information comes out. Looking at everything, I'll tell you how I think about it. I think probably it's analogous to an umbrella. In a light rain, an umbrella can protect you from getting wet, especially if you wear a raincoat and boots, you social distance and isolate and so on. But in a heavy rainstorm, even an umbrella is not going to keep you dry. And I think that's how we have to think about masks. Probably on an individual basis, wearing a mask is protective, but when there's such widespread distribution of the virus, it's so easy to spread. Even people who wore masks some of the time were getting exposed to other times. But there's something else about this that worries me a great deal more, because we have to understand that uncertainty and evolving knowledge is perfectly reasonable. Science it should be, and always will be evolving. What we know today won't be the same as what we knew 2 years ago and won't be the same as what we know in 2 years. And evolving information should reassure us that the process is working. But in developing this week's update, I read as much as I could. I listened to podcasts from both folks who believed in masks and who didn't believe in masks. And what worries me more than the fact that there's uncertainty is how people responded to it. And that's really worries me a lot, because I heard one podcast, more than one, where they said, well, this proves that the CDC was lying to us, or this proves that Tony Fauci was lying to us. Not all misstatements, right? Not all things that are subsequently proven not to be true are lies. 4 or 5 years ago, my doctor recommended that I take a baby aspirin once a day because that was the best medical evidence. Now it isn't. He doesn't recommend that. Would I say he was lying? Of course not. He gave me the best information he had at the time. But the other side of this coin, too, is not all things that are proven subsequently to be wrong were the result of conspiracy theorists. So on one side, we have people accusing the other side of lying, and the other side accusing them of being a bunch of conspiracy theorists. Neither one is true. right? Yes, there are conspiracies out there that are irrational, illogical, but saying that you believe that there was a lab leak may or may not fall into that category. The other thing that worries me quite a bit is people are saying, well, look, this proves that everything the CDC said was wrong. In fact, this proves that ivermectin probably works or hydroxychloroquine probably works. Being right or wrong in one area does not make you right or wrong in any other area or on any other topic. Science says this is the best. These are the best data that we have today. This is how you should interpret them. And the final point I'm going to make is going to alienate a lot of people. But truthfully, being on the right or left politically, being a conservative or a liberal or anything else is completely independent of the scientific facts. This idea that people are interpreting scientific facts through the lens of their political affiliation or through the lens of the news media that they choose to listen to makes no sense. It's perfectly reasonable for someone who describes themselves as a liberal to believe that there was a lab leak from Wuhan. It's perfectly reasonable for someone who describes himself as a conservative to believe that the virus came from animals. They are irrelevant. And it worries me not just how polarized everyone is, but about how angry everyone gets when they disagree with each other. Science is a slow moving process. Our job is to get the best available information that we can, share it as widely as we can. And when that information is proven to be wrong, acknowledge it and move on. So how much should we rethink our assumptions? I don't think we know any more yet. We have to see the Department of Energy report. And in terms of masks, probably they were less benefit than many of us had hoped. That doesn't mean that the masks never work for protecting healthcare workers or others from respiratory illnesses. It just means in this specific instance, with a widespread virus that spreads very easily, probably they didn't provide the level of protection that most of us would like to see. So please share this video with anyone, because the more people who see it, the more responses we get. The more responses we get, the more we can address issues and questions. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And please, if I've said anything that you disagree with, anything you'd like me to expound on, or if you just think I'm off base, please let me know. You can reach me by email. I'll do my best to answer any questions, either directly back to you or in next week's update. So until then, please be well.